Hey, good morning, everybody. Dr. Rayford here, Vet Triage. It is September 23rd, Monday, 7:19 a.m. Pacific time, and we're going to start this live stream with a journal article. I put it in the in the description below this video, but this is from JAVMA, volume 251, number 12, December 15, 2017. It's the first article. This is the journal. Boom. And the first article in there, this one, A Glimmer of Hope for a Fatal Feline Disease. So this talks about FIP, which is Feline Infectious Peritonitis, which is a coronavirus. This is not related to COVID-19 or anything like that. This is unique to cats. So we'll talk about what this article mentions. It's by Katie Burns. It says here that FIP is a leading cause of death in kittens and young cats. It's most common in indoor multi-cat environments. So you see this a lot in catteries and in shelters. It's a devastating disease because it was equivalent to a death sentence back in the day. It still is in many respects, but there's been a strong movement recently because of the increase in prevalence of FIP to try and find more novel therapies that can provide, if not a cure, at least lifelong treatment options to keep the disease at bay. So it's come a long way, and of course this is long overdue. The thought is that antivirals are now the goal of treating this disease, similar to human diseases like HIV, for example, human immunodeficiency virus. So back in the day, so decades ago, FIP was seen hand in hand with feline leukemia, which is FELV. So those two diseases were found simultaneously. They sort of promote each other. But since we've had a FELV vaccine, the incidence of feline leukemia has actually gone down because of the vaccine. But unfortunately, FIP is on the rise. So the causative agent of FIP is a feline enteric coronavirus. So enteric means of the gastrointestinal tract, the intestinal tract rather, and it's a coronavirus, which is an RNA virus as opposed to a DNA virus. And that just comes into play with terms of how viruses replicate. That's why it's important that's an RNA. But it's ubiquitous throughout the world. It's spread via fecal oral route. Up to 60% of cats in multi-cat environments shed the virus at any time. And there are two different serotypes. There's type 1, type 2. Type 1 is a more common one. Type 2 is seen in somewhere between 5 to 20% of cases. And the problem with the two serotypes is they can mutate. They can mutate either during primary or secondary infections. They attack macrophages, which are a white blood cell in the body. And it's also a very common cell that viruses do attack. Now, mutation of serotype 1 or 2 occurs in about 20% of cases, even though the incidence of FIP is 0.3 to 1.3% of all cats studied in North America and Europe. Most cats that undergo this mutation in their body have the ability to respond to it. The question is, why do some cats not able to respond to it? The incidence of FIP in a cat population can be as high as 10% or as low as 0. And that could also fluctuate. So we're going to go through a bunch of factors that risk factors for developing this disease in cats. A high risk is any dense cat population with kittens as part of the equation. And so that includes foster and rescue organizations, as well as dense populations of free roaming cats. So there's 3 categories of risk factors when you consider FIP. This is common really for any infectious disease. The host, which is the patient, the animal, the environment, and then of course the agent itself, which is the virus in this case. So risk factors for the host include things like early weaning of the kitten, or the age at the time of getting infected with the virus. Also, some cats have a genetic susceptibility to the disease. There also is increased risk with hosts that are stressed out at the time of exposure to the virus. And there's also the risk of occurrence of FIP causing mutants. Now, under the category of stressors, because stress is a very non-specific risk factor, Stressors include weaning, which we already mentioned. Early weaning is a risk factor. Overcrowding, which is the reason why we see such a higher percentage of FIP cases in catteries and shelters, as well as the roaming cat population. Elective surgical procedures. So elective surgical procedures might be more of an association rather than a causative effect. And the reason for that is the most common elective surgical procedure is spaying and neutering, which of course lots of veterinarians do, and also a lot of catch and release programs that involve free roaming cats. They're focused on neutering and spaying. So, there's not necessarily there's a reason that spaying and neutering causes the infection or at least increases the risk factor. It's more of surgery itself and anesthesia suppresses the immune system, and that makes animals more likely to contract a disease. So that's a bit of a weird one. Vaccinations are a cause of stress at the time of exposure, and for the same reason as surgery and anesthesia. So when you vaccinate a patient, the immune system takes a hit. It's being challenged to have to respond to the agent in the vaccine. That's how you get the immune response to the vaccine, build up antibodies to it. So vaccines cause stress in that way, and that it challenges the immune system. And then concurrent infections also causes stress. Now, those are all the host risk factors. In terms of environmental risk factors, we've already mentioned some. Overcrowding, sharing litter boxes, the diet, and mixed ages are stressors for the environment. And then as far as the risk factors related to the agent itself, they include the severity of the virus exposure, the strain of coronavirus in terms of its virulence and mutability. So mutability is the likelihood that it's going to mutate. And like we already said, 20% can mutate, either of serotype 1 or serotype 2. Virulence implies the aggressiveness of the virus, its ability to cause disease in the patient. And then finally, the serotype of coronavirus is possibly a risk factor as well. So once the virus enters the macrophages, it's only able to spread disease in diseased tissues, and then it no longer replicates in the intestinal tract. The virus that is passed from cat to cat is ubiquitous and largely non-pathogenic parent enteric coronavirus. So ubiquitous means that it's present everywhere in the environment, like outside, which makes sense. If it's fecal oral transmission, then that makes sense there. And when it says here non-pathogenic parent enteric coronavirus, so coronavirus is the virus, enteric means intestinal, non-pathogenic parent, meaning that the coronavirus itself is typically not a pathogen. It typically doesn't cause disease. It's when it mutates that it causes the problem. So non-specific early signs of illness include anorexia, weight loss, depression, rough hair coat, and fever. And then over time, they end up getting fluid accumulation in the abdomen. The diagnosis is difficult because it's hard to show positivity for coronavirus, believe it or not. So most veterinarians have to diagnose it from history and clinical signs, physical exam findings, the signalment, and that's usually enough. If you have a younger cat that shows non-specific signs and has fluid in the abdomen, there's not many other diseases that a cat of that age, being young, will get other than FIP, especially if they come from a multi-cat household or a cattery or a shelter. But otherwise, if you collect fluid from the abdomen and you submit it for a cell count and protein concentration, those may hint that it's a coronavirus that's the cause. Supportive care will prolong life, and some cats with FIP can live in a state of chronic disease for weeks, months, or rarely even years, or a year or more. And the problem is that immunostimulants and immunosuppressives that are used as part of palliative care are not curative, and neither are vaccines. So we're left with antiviral agents as being the main treatment here. And then on this page, it shows a bunch of cats that were involved in the studies to look at antivirals. So they need to make antivirals that interfere with the replication process of the viruses. So there's 2 preliminary studies that have been performed. Remember, this is 2017, so there could be other studies since then. The first study looked at a protease inhibitor, and the second was a nucleoside inhibitor. So the protease inhibitor was called GC376. I attached that in the first link in the description of this video. You can find that paper there. And it's a paper named Reversal of the Progression of Fatal Coronavirus Infection in Cats by a Broad Spectrum Coronavirus Protease Inhibitor, published in March 30 of the PLOS Pathogens online journal. And the efficacy, and the second one, let's see. Yeah, and the second paper that was released, and again, I put the link in the description, efficacy of a 3C-like protease inhibitor in treating various forms of acquired FIP, and that was September 13th, 2017, Journal of Feline Medicine and Surgery. So you can read those there if you'd like to look at more of that. But they had a pretty good success rate. A lot of the cats end up returning to normal health. Unfortunately, a percentage of cats eventually had a relapse and did not respond to the antiviral drug anymore. Some had a relapse, then went back into remission as a response to the drug. The main side effect in that study was inhibition of the formation of permanent teeth in young kittens. So a couple of things there. Number one, to go from 100% fatality rate to a percentage of cats surviving to normal health, and then a percentage of those cats that relapse to go back into remission is very good. Not great, but it's very good compared to 100% death in the past. And then the inhibition of formation of permanent teeth in young kittens, it's a small price to pay, I guess. You'd say, well, that's horrible that a kitten loses its permanent teeth because of this antiviral treatment. But when you look at the alternative, which is dying, it's not a bad trade-off. Not ideal, of course, but it's not a bad trade-off. Then they looked at a second antiviral agent. This is the nucleoside reverse transcription inhibitor. It's called EV0984. Cats who received this antiviral treatment achieved complete remission. That's pretty cool. 2/3 of the cats were in long-term, hopefully permanent remission as of 12 weeks or so after treatment. That's pretty wild. So again, in a disease that's normally fatal, that's not too bad to receive that. And then the latter, the cats that responded, some of them needed prolonged or indefinite therapy, which that's fine. Again, as long as we have a treatment, that's good. The latter cats may require prolonged or indefinite therapy. No major side effects. That's pretty cool. So that's the end of the article. It's more of a summary of the papers that they've done on this disease, and it's until papers like this came out, and this is still the case now, we had to use a lot of antiviral agents that are like in the black market. People were buying them from overseas and just giving them to cats because even though there's no studies on it, because of how fatal the disease is. And I have seen cases with success with those. I don't know if those products are the same as these two. I imagine they probably are. But anyway, the point is that there are many organizations that are passionate about trying to obliterate this disease that was once thought to be fatal. It still is a scary disease, but at least now these studies show there's hope. So yeah, and that's where we'll stop this video. I hope everybody enjoyed that. We'll do another journal tomorrow, Tuesday, September 24th, and we'll talk to you guys then. That's everything on FIP. Thanks for those who watch the playback and they subscribe and support the channel. Bye. 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 Bye.